Hi, I'm Dr. Lahar in Beverly Hills, California. And one commonly asked question is, what will happen to my BBL in 5 to 10 years? Typically, during a BBL, I am taking fat from another part of the body and transferring it to the buttock to create a larger or perkier or more aesthetic appearing buttock that fits with the body and with the goals of the patient. Everything we do from the consultation, the surgery, to afterward is all about increasing the longevity of your results. Unfortunately, only about 50 to 70% of the fat that I inject into the buttock is going to survive. And everything I do is intended to maximize the amount of fat that I put in, that survives in your buttock. Now, that may include adding a little bit more fat than you intend initially, and that also includes offsetting pressure off your buttock for about 6 weeks, and even using modalities such as hyperbaric oxygen to improve the take or the survival of the fat that I put into your buttock. Because the fat is removed from another part of the body, taken out of the body and placed into a new site, such as the buttock, doesn't have the blood supply that it did when it was originally inside the body. And so we're doing everything we can to make that transition for the transferred fat as easy as possible. And so things like sitting on the buttock are going to stress out that fat, and stressed out fat or tissue is going to tend to be resorbed by the body, or it's going to tend to die, and you're going to lose that fat. And so we're really trying to create an environment that is not hostile to the fat, that allows the fat to take within its new neighborhood. Avoiding sitting on your buttock is a challenge, and you have to be ready to do what you can after surgery, and you have to prepare for it before surgery. And one of the main methods is to lay on your stomach. However, that's not always possible, or you can't do it all the time. For instance, if perhaps you had a tummy tuck at the same time. And so there are other modalities to avoid sitting on your buttock. You can simply sit on a chair with your buttocks hanging off of it, but there's also specialized BBL pillows that will allow you to put more pressure on your thighs and offset pressure off your buttock. You can also use just regular pillows to put under your thigh and under your lower back. And if you go online and look up different BBL pillows, you'll even find things like BBL seats with the hole cut out of it, or specialized chairs that remove all the pressure from the buttock. Now, when all of these things take place and they're optimized, you can get a really nice result that has a long-lasting effect. And all the fat that does survive after about the 3 to 6 month mark is yours to keep. And you will have that result 3, 6, 12 years after the result, because that fat has now become a part of you and has long-term survival.